Look like with a little bit higher nose. She had a beautiful ethnic nose, and we were talking about doing some small augmentation only. And in order to find out whether that is a good procedure for her, we are going to do that augmentation with the non-surgical means, adding the small amount of radiase, soft tissue filler, into that area. Patient will then decide whether she liked it, how much of augmentation we need to do, and then based on that we are going to do more permanent procedure. This is something that we do occasionally for people with the ethnic noses. We take a cartilage from the rib, slice it in fine pieces, 1 millimeter pieces, wrap it up like in a cigarette, and then put it on a dorsum and shape it nicely. So that is her own tissue. It does not require any additional material. It gets integrated with her body, and it's just part of her. So that's the most natural way of doing augmentation in the noses. It's otherwise known as a Turkish delight. So we are going to start with the soft tissue augmentation as preparation for other more permanent procedures. Going to do that, there is no anesthesia involved. This is a material that does have anesthetic inside. So there is just a minimal discomfort at the beginning of the procedure. And I'm going to augment this portion of her nose here, and then we'll make decision whether we need more or stay with this. So this is a minimal amount. I'm using about 1.5 milliliters of radiase for this procedure. And again, I'm going very deep over the bone, because that is really what we are trying to augment, her bone. And I'm doing that gradually, and that is like a paste, so I will be able to mold that material as I go down. How bad is this? Are you feeling much of a pain?
Mm-hmm.
So I can mold it and give her augmentation that I need. So there is already a significant difference in the appearance of her nose in this part in here. So we are going to add some small amount, then going from the other part of the, just to see how does it look like. It's already making some difference. Okay. So you see, as I'm injecting, the projection of her nose is increasing. Patient in many ways. So I'm going now again to mold this soft tissue filler. So I'm going to show you now the result that we have achieved to this point. Okay, Lena?
Oh. This is really nice.
Yeah, it's very nice and gives you the idea
Yeah.
what we are going to achieve if we use that, because I can mold your own tissue very much the same way, and this is a minimal enlargement. I would like, if you don't mind, to
over a little bit
in here. I don't think that we need to do anything in here.
Yeah.
But I would maybe try to lift this part a little bit.
Yeah, exactly. Okay? Yeah.
Maybe less painful now.
Because then this part look a bit straight, and then this one
it's still concave.
Yeah,
so we are going to try to make that a little bit straight as well.
Yeah.
So that's the next project. Okay. To go, so give you a shot in here. That may hurt a little bit more than before, because it's relatively big needle that I'm using for this, but works very well.